Thank you for referring your patient to the Barts Heart Centre for consideration of a TAVI procedure. We've done this video today to briefly explain our inpatient TAVI referral pathway to ensure that patients have a timely assessment and treatment for their aortic stenosis. All of our inpatient referrals are done via email correspondence. So please send us an email along with the completed inpatient pro forma to bartshealth.tavicns@nhs.net. Kindly ensure that you fill out this form with as much detail as possible, including the patient's current clinical condition as well as their frailty assessment, as this can influence how quickly we plan treatment and transfer. The pro forma can be downloaded from our Barts Heart Valve webpage. Along with the referral, please also send us the patient's most up-to-date echocardiogram images, and if you have them, the CT TAVI scan and angiogram. The images should be sent to the Barts Heart Centre PACS department via the Imaging Exchange portal. Please liaise with your imaging department to help facilitate this. If we don't have the images available, this can potentially delay us processing the referral.
So once the referral has been made, this will be triaged by one of the clinical nurse specialists, and if appropriate will be accepted by one of the consultants of the week. So the patient will then be discussed in our virtual Valve NDT meeting, and then we will decide the best treatment options to the patient given the severity of their symptoms and their clinical need and status. So this is held every Thursday of the week, and we always aim to discuss each individual case according to clinical urgency. We will invite local teams to dial into this meeting so they can provide valuable input with regards to the current clinical status of the patient. This will provide essential information in the decision-making process. Details of the meeting will be provided to the main contact person indicated in the referral form.
Outcome from the meeting will be mostly one of the following. If the patient is accepted for inpatient TAVI, the nurse TAVI specialist will organize a transfer to our facility and accommodate a TAVI slot for the patient for the following week if possible. Availability of inpatient's bed and TAVI slots are highly dependent on multiple variables, considering that we are one of the busiest tertiary heart attack center. However, our average time frame from referral to treatment is around 2 weeks. If the patient is stable enough and can be seen as an outpatient for further review, they are then scheduled at the next available appointment with one of our consultant cardiologists, or they can be seen in our new nurse-led TAVI clinic. If the decision is for medical management or valve surveillance, patients are then referred back to their local hospital for further follow-up appointments.
Barts Heart Centre now has a new Astrid AS pathway, which is an expedited process for patients who develop acute cardiac decompensation as a direct result of severe aortic stenosis. Patients are prioritized in this pathway where their assessments and treatment are fast-tracked,
and we aim to treat patients within 5 days from referral.
For all patients, we always recommend sending out your referrals as early as possible so that we can coordinate and plan things accordingly.
Thank you for taking the time to watch this video. Please don't hesitate to get in touch with our team should you require further information.